When we talk about liquid biopsy, it's basically a process to evaluate a cancer biology in a liquid media. And the commonest liquid media that can be obtained from a patient's body is a blood sample. Now, when we take the blood plasma from a patient and evaluate the genes and the mutations related to cancer in the blood plasma, that process or that test is called liquid biopsy. This is a revolutionary and a very new as well as a supportive diagnostic modality which is now available, especially for patients with non-small cell lung cancer and cancers of the colon, where with the help of liquid biopsy, an evaluation of the gene mutations which are either supportive or disruptive to a particular targeted treatment can be deciphered. So follow-up biopsies, which are tedious and cumbersome procedures to get a repeat biopsy from such a patient, is completely alleviated, and you can do an evaluation of the tumor with the help of a blood sample. This process is liquid biopsy, and Medgenome Labs, which is South Asia's one of the largest gene sequencing diagnostic laboratory, has done a very broad evaluation and validation of the liquid biopsy test that we perform for lung and colon cancer patients with Tata Memorial Hospital, and that evaluation has shown that this liquid biopsy test is an extremely sensitive test which can give an understanding of the progression of tumor progression at a relatively early stage, besides giving invaluable information to the clinician whether to continue a certain treatment or to change to another treatment modality. These are targeted treatments, so they are more expensive, but they are very effective. And liquid biopsy is an adjuvant mechanism to see the tumor response just on a simple blood-based test. So the patient does not have to go through the process of invasive biopsy repeatedly. It is a simple blood-based test. So that's the fundamental behind what liquid biopsy is. Of course, this test itself indicates that we have moved from morphologic evaluation of tumor tissue through microscopy, which was earlier the predominant diagnostic modality for cancer, into a minimally invasive approach to follow up a tumor. With the advent of technology, we are evaluating liquid biopsy to be done on next-gen sequencing as well as by digital droplet PCR, which will bring down the cost of this test further, and possibly enhance this test from presently we have validated it for 4 genes which are targetable mutations in these 2 cancers. We are we are validating to expand this to include over 50 genes which can be used for many different cancers, for many other treatment modalities as well, and also prognostic information on the patient which can be derived from this simple blood-based test. So these are the advantages and these are the future prospects of liquid biopsy.